Hi there, I'm Dr. Bobby Chhoker, cosmetic and implant dentist based here in Sydney. Come on a journey with me as I show you behind the scenes in my life and in my clinic. What do I do about my wisdom teeth? First of all, do they need to come out? There's a number of reasons that you would have your wisdom teeth removed. First and foremost, pain. People usually do something about their wisdom teeth when they're in pain, and quite often it's better to go and get an assessment if you think something's happening way before the pain starts. If the episodes of pain are getting more intense and closer together, that's a good reason to have a look at whether you need to have them out, because usually if you're in pain, they need to be taken out. Now, the other reasons that you may have them taken out, and there may be no pain whatsoever until it gets to the very sort of late stages and complicated stages of it, are number one, the tooth or the wisdom tooth is associated with a pathology. And what that means is an abscess, a growth, an infection. Number two, it's jeopardizing a perfectly good tooth. Quite often you've got the straight tooth here and the wisdom tooth is impacted, meaning it's tilted and stuck behind the other tooth. That's what that means. And that tilting causes an area here that you can't clean very well. So what happens is things stagnate there and they start decaying this perfectly straight and good tooth, which has been used with the teeth on the top. And what you really want is to get rid of the offender and keep the good tooth. Thirdly, they may be taken out if they've had a fracture or they need to be taken out for orthodontic treatment. With these three, there are no real symptoms, so there's no real stimulus that makes you come into the dentist and have them checked out. When you have pain, you're very quick to come in, so it's a good idea when you have your wisdom teeth coming up, whether it's at those early stages of 18, 19, 20, or even later in life where you've noticed some differences, to go and have them checked and see what's going on. There's a good reason for having things checked early, because usually if you nip things in the bud, quite often, one, you could avoid surgical treatment or extraction. In certain cases, you can have a look and we monitor them. We can give you some instructions to keep them clean and not get any infection. If they are tilted and we want to keep them, we can actually upright them using various techniques. Those are the main benefits, because if it's left for much longer, the situation becomes complicated. So the process is initially to come in for an assessment. Realistically, you really want somewhere that can do what's known as a CBCT X-ray. That's a 3D X-ray. We have one here. And what we're trying to check is towards the back of the jaw, you have a very large nerve that runs along the jaw, which we want to protect at all costs. But at the back of the jaw, it loops upwards to its entry about here, and that's where it's closest to the teeth, and lo and behold, that is where the wisdom teeth are. So what we want to see is the relation of that nerve to the tooth, because if it's very close or actually grasping or wrapping around the bottom of that tooth, you need to be referred to a maxillofacial specialist to have it removed so that nerve isn't damaged. If it's not, or it's even close, then someone such as myself that deals with a lot of oral surgery can take it out for you. But without that assessment, we don't know, and you want to keep yourself safe. Once we've established that they can be taken out, we then make a plan. There's a treatment plan put together with all costings, timings, and everything else. And then we basically are with you throughout the process. The first thing that people ask are, what are the pain control options? The process itself is painless. And it can be done in two ways. One, it can be done with local anesthetic. Here, we tend to use an anesthetic that's a bit stronger than your usual dental anesthetic, because I do a lot of work with bone and implants and teeth. We can use that for that process. You don't feel anything, but you are awake through the entire process. The alternative is twilight sedation. Twilight sedation makes you groggy, sleepy enough that you don't really know what's going on. The teeth are extracted and you wake up without the teeth. With pain control after the procedure, as long as you're taking the drugs that we give you, which usually cover inflammation, infection, and pain, and you're using our post-operative techniques, which involve ice packs and a few little bits and pieces that we put together and printed out for you, so you know exactly what's going on. But if you're basically following protocol, and we have a very tight protocol, it's largely uneventful. The important thing is to start a conversation. You're coming in, you've got pain, or you've got a situation, and we promise you that we will look after you, have a look at what's going on, and give you a free, no obligation consultation. That includes your X-ray. We can then assess what's happening, what needs to be done, and make a diagnosis. And then you can make an informed decision rather than an ill-informed one. So, what are you waiting for? If you have a problem with your wisdom teeth, or you're wondering about them, or you're in pain, give us a call or visit our website. We'd love to see you. I'm Dr. Bobby Chhoker, cosmetic and implant dentist based here in Sydney.